Hello, good afternoon. I'm Dr. A. Santosh Kumar, nephrologist consultant in Kamnani, LB Nagar. I'm also a transplant physician. So I am getting frequently calls from patients or relatives of the patients asking whether we are supposed to take vaccines. Are we at high risk of the vaccine-related side effects or not? So as a brief, I'll talk about who is supposed to take it, who is not supposed to take it, and that's just a general statement. And any specific things are present, you need to again ask your doctor per se to identify whether you are at high risk or not. See, vaccine, any person who is more than 18 years of age can take a vaccine, any person. Now, as the vaccine is not easily available, that's the reason government has made some standard rules saying that those who are aged people more than 6 years old, so they are at high risk. So that is the reason they are given more priority for taking the vaccine. And let's say if a person is more than 45 years of age, if they are a diabetic, hypertensive, heart disease is there, liver problem, kidney problem, or recently treated lymphomas, once they have got treated, or they are some sort of transplant recipient, in these individuals, whether to go ahead for or not, we have to again certify. So we require a separate permission from the treating doctor saying that they are at higher risk, or they require a vaccine at an earlier stage. Now, the vaccine which you are taking, that is more important. That is, once you are taken, let's say there are two vaccines which are available now, Covishield and Covaxin. You require 2 doses, that is 1 month apart, you need to give it. So one vaccine which you are taking, you have to use the same vaccine after 1 month. You should not change the vaccines. So the other thing is, should we take the vaccine? Are we at high risk? Or those people who are not supposed to take the vaccine. Let's say you're taking a vaccine, you develop some allergic reaction, that is anaphylaxis like, meaning to say suddenly shortness of breath develop, BP drop down, patient developed some sort of bradycardia, heart rate changes are present. In these events, you are not supposed to take the vaccine. So that is one contraindication, meaning to say the person who has taken the vaccine is allergic to that specific vaccine. So you need to prevent from taking the same one. Second person who should not take, that is, recently they have been diagnosed to have COVID positivity, RT-PCR, or recently they got treated for COVID within a period of hardly 60 days. For those individuals also, we are not supposed to take vaccine till that 60 days period is over. And let's say some person was admitted recently for COVID or for any other condition wherein the patient is in the hospital relatively unwell because of some other condition. Let's say patient might have some sort of pneumonia which might not be related to COVID, or could be related to kidney failure or liver problem or heart problem, or any sort of infection for which he is admitted into the hospital. During that time, it is not indicated that we should go ahead. Or patients who got treated with COVID and they had received antibodies, in those individuals also we are not supposed to take the vaccine immediately. Pregnant individuals or those who are lactating, who are recently planning pregnancy, or they are doubtful about their pregnancy status, for those people or those women are also not supposed to take the vaccination. Apart from that, there are few conditions wherein patient-related conditions wherein we are not supposed to take a vaccine. One thing is clotting factor deficiency or platelets which are on the lower side. There are some diseases which might cause, apart from the infective causes, that might be autoimmune related diseases wherein the platelet count will be on the lower side. So those people should not take vaccine. Or if, let's say, patient has been on some sort of blood thinners, meaning to say some medicines are there which are responsible for causing the blood to become very soft or it won't clot easily. So anticoagulants are some of the medicines which the patient is taking. Those people also should again consult their doctor to find out whether they are supposed to take a vaccine or not. Or if patients have some sort of genetic abnormality wherein they have a coagulation defect, that is, their blood doesn't clot properly, even in those individuals they are supposed to ask their own concerning doctors to find out whether they are supposed to take it or not, depending on their risk. The frequent question which I am asked, let's say some of the patients are on steroids, or they have undergone renal transplantation, or because of some other condition they have been using steroids. Some other condition could be because of joint pains, could be related to the rheumatoid arthritis, or some other connective tissue disorder related, they would have taken some steroids. So in those events, are we supposed to take medicines or not? There is no consensus, but the general thing is whenever we have a person who is on steroids, the vaccine efficacy comes down, meaning to say your body's ability to produce antibodies is on the lower side. That is the reason it is not useful for you to take it. Even if you take it, it might not be so much efficacious. I hope this short video at least clarifies your doubts. Everyone, at least it is spread to others so that everyone else gets the same idea about whether they are supposed to take the vaccine or not. And I hope that everyone takes the vaccine, those who are fit enough, and have a healthy and safe life.